Before anesthesia existed, healers in Baghdad had only herbs, honey, and steady hands for surgery. Have you ever wondered what happens when the herbs don't have enough time to work? This is Baghdad, 1,000 years ago, one of the largest cities on earth, and home to the House of Wisdom, a great library and school where scholars from across the world came to translate and discover new ideas. Inside its Bimaristan, its hospital, sick and injured people were treated for free, day or night. Today, doctors give patients anesthesia, medicine that makes them feel nothing during surgery. 1,000 years ago, that medicine didn't exist yet. Ibrahim, 17, is training here, learning from the finest surgeon in the city. That surgeon is Ustad Karim. Ustad means teacher. 30 years of practice and hands that never shake. Watch closely today, he tells Ibrahim. Today, you'll see why steady hands matter more than anything else we have. A merchant named Dawood is carried in, doubled over, gripping his side. A stone has formed inside his body, and it will not pass on its own. It has to come out. Karim presses gently along Dawood's side, feeling for exactly where the stone sits. There's no machine to look inside a body here, only patient hands and years of experience. It must come out today, Karim says. Ibrahim, prepare the sponge. There is no medicine yet that can make a person feel nothing at all. But there is something that can make the pain bearable. A natural sea sponge, soaked for hours in a mixture of poppy, mandrake root and wine. Held under the nose, its scent alone can make a person drowsy and calm. It's called the soporific sponge. Soporific means sleep-bringing. But it needs time, usually the better part of an hour, to take full effect. Karim lays Dawood down, holds the sponge gently beneath his nose, and they begin to wait. While they wait, Ibrahim lays out every tool exactly where his teacher taught him, each one washed with wine, then wiped clean. Order matters. A dropped instrument mid-surgery could cost a life. 20 minutes pass. Dawood's breathing slows. His grip on the table loosens. The herbs are starting to work, just as they're supposed to. But what if 20 minutes isn't enough? What if the infection doesn't wait? Then, suddenly, Dawood cries out and curls sharply. The stone has shifted, and his side is hot to the touch. Karim's face changes. Something is wrong. Infection, Karim says quietly. It's spreading faster than we expected. The sponge has only been working 20 minutes. It needed a full hour. There's no more time to give it. Wait, and the infection could spread through his blood. Operate now, and Dawood will feel more than anyone hoped. What would you choose? Karim doesn't hesitate. We operate now, he says. Ibrahim, hold him steady and talk to him. My hands will do the rest. Ibrahim leans close to Dawood's ear. Focus on my voice, he says softly. Breathe with me, in and out. You know that feeling right before something scares you, when someone's calm voice helps you through it? That's exactly what Ibrahim was doing. Karim works quickly and precisely, exactly where his fingers marked the stone. No wasted movement. Every motion is one he has practiced 1,000 times before. And then, there it is. A single hard stone, no bigger than an olive pit, finally out. Karim packs the wound with honey, its own kind of medicine, known even then to fight infection, and binds it with clean linen. Simple, ancient, and it works. 3 days later, Dawood's fever breaks. He sits up, and for the first time in a week, he asks for bread instead of water. Ibrahim has never been so relieved. That night, Karim writes down exactly what happened. The timing, the herbs, the honey, every step, so that the next physician who faces this same hard choice will know what to do. Baghdad's Bimaristan treated anyone who walked through its doors, rich or poor, free of charge. Herbs, honey, and hands that had learned not to shake. Next time, in Built by Hands, a wall meant to run unbroken for thousands of miles. What happens to the crew who runs out of stone halfway through? A new story every week. Follow the golden thread from before buttons to threads of time.